everybody, I'm Dustin Major with Loomis Basin Equine Medical Center. I'm one of the surgeons here, and today I'm going to show you how to do an appropriate limb bandage for wounds on your horse's legs. Well, hi everybody, I'm Dustin Major. I'm one of the surgeons here at Loomis Basin Equine Medical Center, and today I'm going to go over how to appropriately place a bandage on one of the legs of your horses. And I'm going to go over basically the different bandage materials that we use, what each one of them kind of does, and how to appropriately apply them. And then we'll actually put them on the horse so you can see how it's done. So yeah, let's get started on the bandage material, shall we? So first, you're going to need a box of exam gloves. These are obviously not sterile or anything like that, but believe it or not, you cannot get all the bacteria off of your hands. So it's really a nice idea to have a box of these. They're very cheap. Find them in any CVS or whatever. And you're just going to wear these when you place at least the inner layer of the bandage. And I'll go over what that means in a second so that you're not adding staph and things like that to the wound. So once you've got those guys on, a lot of people, depending on the wound, will recommend you put some sort of ointment on the wound. If you're going to have one thing, and one thing only, this is triple antibiotic ointment, or Neosporin. Super cheap, super effective, works on any wound. It will never be the wrong thing to put on it. So if you're going to have one thing, this is it. This is what we call SSD cream, or silver sulfadiazine. This is really nice for acute wounds, so kind of just after they've happened, up to a week after they've happened, something like that. I don't like to put them on chronic wounds once they've sort of granulated and are moving into the chronic phase of wound healing. But this is great for abrasions. Again, it's hard to go wrong with this. It's just more expensive, and then we don't like to use it on the older wounds. Once you've got that on the leg, then you're going to use some sort of what we call a non-adherent dressing. So this one here is a generic non-adherent pad. Again, you can pick these up at CVS, get them online. They come in different sizes, so you can buy them, in different sizes according to whatever wound you have. This is what's going to go directly against the wound, and that way when you take the bandage off and change it, this doesn't stick to your wound and pull everything off. It just comes off really nicely, kind of like the inside of a Band-Aid. That's going to be held in place with what we call cling gauze, C-L-I-N-G, or just white gauze. This is a roll of it. This will go on to sort of hold this in place. And then we often will sort of secure that with what we call elasticon. So this is a stretchy, sticky on one side tape that we place against the leg. This is safe to put directly against the skin without any padding, as long as you don't pull it too tight. And I'm going to show you how to do that in a minute here. This is about the only thing that has any sort of give to it that we recommend you put directly against the skin without any padding. If you use some other things like vet wrap or something like that, it's really easy to put it too tight, and you can injure tendons, you can kind of compromise blood supply. It's not a good idea, okay? So non-adherent pad, cling gauze, elasticon to seal it off, and then over the top of that, you're going to put what we call sheet cotton. If you go online and put in horse sheet cotton, this is what comes up. It comes in a very large pad, and then they come in individual sheets like this. I don't know if you can see that, but here we have 4 sheets that are folded in half. Show you that to you. And so the nice thing about these is they're a rectangle. So if you fold it with the crease like this, they're 12 inches. So that works really nicely for a forelimb. If you fold it the other way against the crease, they are 14 inches. So that works better for a hind limb, okay? So nice little tip, little pro tip for you. But again, you just take 4 sheets off, put them together, fold them over, and then roll them up. And the tighter you roll them, the better it goes on against the leg. So you'll notice I'm trying to get it as tight as I can. And if you use 4 sheets, it is very hard to put a bandage on too tight, okay? It's possible, but it's very hard, all right? So 4 sheets. Then what you're going to use is what we call brown gauze. This stuff is really great. It's nice and cheap, but again, it doesn't give much, so this is always has to go over padding, okay? This provides compression and then stiffness to the bandage. So it's a really important component of the bandage because it sort of prevents motion at joints and sort of that sort of thing as much as possible. But this goes on nice and tight, and I'm going to show you how to do it appropriately, but that'll be your next layer to provide mostly some stiffness to the bandage. And then you're going to use vet wrap. Okay, so this stuff usually comes packaged like this. It is nice and stretchy, but this is what you do not want to put directly against the wound. It's very easy to put it too tight, directly against the leg. Very easy to put too tight. You can injure a tendon and that sort of thing. So this always goes over padding as well. So all of these things you can actually get in our store here that we have open essentially 24 hours at the clinic here at Loomis Basin Equine Medical Center. So let's get started on how we're going to put this on the actual horse. So first things first, I'm going to put on my exam gloves to protect the wound from my bacteria as much as anything else. And when we put these on, you'll notice I'm handling them sort of at the end of the glove, trying not to touch the fingers and that sort of thing. I pull one on, and then again, just touching the end of it, put the other guy on, okay? So now your hands are nice and clean, and you can handle things without as much fear of introducing bacteria to the wound on your horse. So I'm not going to put any antibiotic ointment or anything on this horse because we don't have an actual wound. It's just a demonstration, so we'll just start with our non-adherent pad and our cling. So then I usually get my elasticon ready to go. And then I have my cling ready to go as well. And so we're going to use the front limb to do this demonstration. And we're going to do what's called a distal limb bandage. So distal meaning towards the end of the limb. And we're going to basically place it from the carpus down. Now you can always stack bandages. So you would put the first layer with the brown gauze up to here. You'll see what that means in a minute. And then you do another layer above that. So it's just sort of a continuation of the bandage up the limb. So if you can do this bottom one, you can essentially do both, okay? So starting with our non-adherent telfa, or non-adherent pad. So you'll notice when I take this out, I'm not handling the part that's going to go against the wound. I'm just touching the edge of it. Either side of this can go against the wound. They are both coated with a non-adherent sort of plastic coating. And then I get this sort of spooled out so that I'm ready to go. Now when you wrap the limb, you are always going to go from the inside of the limb across the front to the outside of the limb and then around the back to the inside of the limb, always moving in this direction. So on the other limb, you would go from the inside across the front to the outside and around. The reason for that is you are stronger when you pull, okay? So if you go around the wrong way, you're pulling on the tendon and it's more likely to injure it, okay? So sometimes you'll see us do it that way because we have a lot of experience with it, but you as a beginner, until you get a lot of experience under your belt, should always go across the front because you're much less likely to injure the tendon, what we call bowing a tendon. So again, handling the outside of your non-adherent pad, and we're going to say that the wound is here on the cannon bone. So I'm getting it ready to go essentially. I have a little bit on the edge and I'm only touching the edge of the pad, stick it against the wound, and then I'm ready to start wrapping. Often horses will move as soon as you place it against the leg, and so you want to kind of be ready to start wrapping so that way so you can kind of move with them as they hop around or whatever. And then you'll notice that I'm just sort of spooling it out. I'm not pulling it tight, right? I'm just sort of snugly but not tightly rolling it around, and this is only to keep that non-adherent pad in place, okay? Spooling it out, spooling it out, spooling it out. Okay. This stuff is pretty springy, so you have to sort of tuck it in. So I just kind of grab my last little wrap that I went around and just tuck in a little tab right there, and then it sits really nicely, okay? Now, usually because it's really important that this stay in place, we're going to put a little elasticon around here to do a little what we call an inner bandage. So this stuff, like I said, is really nice and sticky on one side, not sticky on the other, and nice and stretchy. The other thing you'll notice is it has this red line in the middle of it, and the reason for that is so when you're wrapping around, you sort of overlap it 50% each time. So I usually start with it like right on that red line at the top of my cling, and then I'm going to spool it out. You'll notice that I'm holding it in place here, spooling it out because I don't want it to be tight. You can see how much it stretches, right? I just want it to be snug as it comes around, okay? So same thing, I'm gonna hold it in place, spool it out a little bit, and then I'm gonna head down the limb. And you'll notice I'm overlapping it almost exactly 50% every time. That's exactly what we want to have happen, okay? Go around, spool out just enough to go around, spool out just enough to go around, okay? This stuff is very hard to tear, so you may want to have some scissors with you. In fact, I would say you definitely want to have some scissors with you. And then I just kind of go back up. It sticks best to itself. It is made to stick to the animal, but it sticks best to itself. So when you start it and when you end it, you want to make sure that it goes back onto itself, and that way it doesn't come unraveled. All right. So now we have our little inner sanctum here. We're ready to put the compression and stiffness portion of the bandage on over the top of it. Additionally, I'm not worried about introducing bacteria to the wound anymore, so I often take my gloves off at this point because these materials are a little easier to handle if you don't have the gloves on your hands. Okay, so I have my 4 sheets of cotton that are now rolled up nice and tight. I'm going to go ahead and open my vet wrap so that it's ready to go. It's really important to have everything ready to go so you're not fumbling with it while the horse is trying to move around on you and that sort of thing. And everything's just sort of on my table or in my hip right here so that I can grab it really quickly. So now it doesn't matter which side you have up or down, but it does matter that you continue to go from the inside across the front to the outside. And you'll notice that I'm going basically right up to the knee, okay? The accessory carpal bone, you can feel it's a bony prominence right here on the back. We're basically gonna go to that point and have the bandage cover the entire limb from here all the way down to the foot. Okay, so again, nice and tightly rolled. I'm gonna put it in place, and then I just sort of push it to the leg and unroll it. So I'm not trying to pull on it. If you try to pull on it, it just spins around the leg. So press it to the leg and unroll it. Now holding that in place, I'm going to start at the bottom of the bandage so that it doesn't get pushed down as I apply it. That first roll just kind of holds it in place. And then now I'm going to be really tight with this because now I have a lot of padding here, and so I have the luxury of being nice and tight. I stay above the bottom of the padding though. And so what I usually do is I spool out just enough that I can pass it around the leg, and then I keep it tight that entire time. And then that same rule of overlapping at 50% applies here. Nice and tight. Nice and tight. As long as you apply that even pressure with adequate padding, it's very hard to put a bandage on that's too tight or that will injure tendons and that sort of thing. Again, possible, but much less likely. And you see I'm kind of holding it in place so it doesn't wrinkle up. And so the leg is quickly becoming this sort of uniform brown tube because I'm overlapping it appropriately. And again, leave padding at the top. Spool it out, pull it tight, wrap it around. Spool it out, pull it tight, wrap it around. All the way to the end. And that'll usually stay there because there's not a lot of spring to it. Okay, and so once you've got that nice and smooth down, your nice uniform brown tube, you're gonna use your vet wrap. And so again, this is nice and springy. So you can see you can pull all the wrinkles out of it. So again, starting at the bottom, I get my first wrap around, that kind of anchors it, and then I spool it out, and you can see I'm pulling it pretty tight, right? So there's all the wrinkles, I pull them out, and then I wrap it around the leg, okay? Hold tension on it, wrap it around. And so I'm basically just pulling out just enough to go around the leg, and that takes a little practice, I'm not gonna lie. I wouldn't expect it to be perfect your first time, but again, overlapping about 50% every time. Going up the leg, leaving padding at the top, and then heading back down the leg. Look at that beautiful bandage. And a pretty bandage is a functional bandage, all right? So if it looks good, it works good, all right? So then you're gonna come back, take your elasticon. This is 3-inch elasticon. It also comes in 4-inch. It comes in 2-inch for people. That's too small. It needs to be either 3 or 4-inch, okay? Now, for this one, you're gonna start almost 1 full width above your bandage because you really want this to stick to the skin and seal off, okay? This is basically to keep the bandage from slipping and to keep shavings from packing down inside of it and irritating the skin and getting access to the wound and that sort of thing. And then you're just gonna keep on going down and essentially just cover that top portion of padding you left exposed, okay? So again, cut it off and wrap it around so it sticks to itself, right? Then on the bottom, same thing. Just make sure that you come, at the very least, that you come below the heel bulbs. You can see here that I'm coming below the heel bulbs. That prevents the bandage from slipping up the limb, okay? And then we're gonna come down so it sticks to the hoof itself. And then I just use up whatever's left of my roll. And again, sticking it to itself, okay? Now, if either of these come loose or slip down, you just add a little bit more. As long as the bandage itself is still in place, is not super soiled, and is not compromised in any other way, you can add a little bit of elasticon to the top or the bottom just to keep it sealed. And then remember that you've got your inner bandage there to help protect it in case something does happen, this comes loose, a little bit of shavings gets in there, it's no big deal now because you've protected the wound on the inner bandage. So once you've got that done, you've got a nice bandage, and then we typically change this every 3 to 4 days, twice a week essentially for most wounds. If there's some different reason to change the bandage, we're gonna let you know that, but the vast majority of wounds we change every 3 to 4 days. And there you have it. So enjoy, and good luck with your wound.